Hi, and welcome to this week's Wednesday Wellbeing panel. For those of you who don't know me, my name is Heidi Wright, and I'm Practice and Policy Lead for England here at the Royal Pharmaceutical Society. I just want to take this opportunity to say a huge thank you to all of you for going above and beyond every day and for putting the needs of your patients and the public first. Today, I'd like to welcome Lynette Roberts, who is from Captivating Training Solutions. Lynette
Really nice to be here, thank you.
Brilliant. I'm just going to give you a little bit of background on Lynette. She's a multi-award-winning training.
Oh, we can't hear you, Heidi. You've gone very quiet.
Okay, I'll try and speak a bit louder. Is that okay?
Yeah, yep. That's better.
Okay, so just to give a bit of background to Lynette, who is a multi-award-winning training specialist and international speaker. He's got 15 years in the healthcare sector. Lynette has developed training for some of the largest brands in the biggest therapy areas. And you all know Harpreet Channa. She's our resident pharmacist panel speaker who runs the Mental Wealth Academy. So welcome as well, Harpreet.
Thank you. Hello.
Today's wellbeing webinar is focused on how to have a conversation about mental health. And this is a very difficult area for a lot of people. So work is quite often the most stressful factor in some people's lives, but you don't often feel able to ask for help when you're struggling. So this silence feeds misunderstanding and prejudice, which can make it harder for people to be open. So it is really vital that managers routinely ask staff how they're doing and discuss their mental health. And this help builds up people's confidence to speak up earlier on and also get the help that they need sooner. So organisations need to send a clear signal to staff that their mental health matters, and being open about it will lead to support rather than discrimination. And a simple way to communicate this is to explain that mental health will be treated in the same way as physical health. We're always being told we should be talking more about our mental health, but when it comes to actually doing it, speaking up and opening up to people that you're worried, it can be quite scary. So what if you offend someone by what you say? What if it ruins your friendships or relationships? And what if it all comes out wrong? So there are a lot of what ifs, but perhaps the biggest one we should be asking ourselves is, what if not talking about it means things get even more difficult? So there's lots of reasons why people might be hesitant to start a conversation about mental health. And as mentioned before, it might be around causing offence or making things worse. It could be around harming their working relationship. People may not want to get involved in conversations about mental health. It's a tricky area, and then might not be sure how to respond to someone who is opening up about their mental health. So welcome both Lynette and Harpreet. I'm going to start with you, Lynette, and ask if you can perhaps explore why it is that people struggle to discuss their mental health compared to their physical health.
So I want to talk about why it's so easy for physical health, people to talk about physical health, is it's widely accepted. It's usually with physical health we can see the problem, but with mental health it tends to be an invisible problem unless you take into factor the behaviours that you see. But for me, I think the main reason, or the main reasons that people struggle, is around things like stigma. A lot of shame is associated with mental health, fear and fear of judgment, and things like discrimination. That I think that's what really people fear, is that when they are honest and open about their mental health, and it's that itself makes it difficult for other people to approach others, that again, how will they react? So that's my kind of thoughts around as to why it's so much easier to talk about physical health than mental health.
Yeah, I think I agree with that. It is really difficult to open up about it. And I've had an experience where one of my flatmates has had mental health problems, and she found it really difficult to speak about. And I actually found it quite difficult to start that kind of conversation. And as you say, it's a lot easier to talk about physical health because you can see it. Whereas mental health, obviously, you can't. So I know both of you have had your own personal struggles with ill mental health, and you both obviously speak quite openly about that now. But just a question about, were you so open about it at the time when it actually happened? And Harpreet, I don't know if you want to speak first about that.
Not at all. I wasn't open about it at all. And I, as you said, I talk openly about it now because I want to explain to people how easy it is that we can fall victim to mental ill health. And I think it's important we make that distinction, because we all have mental health just as we all have physical health. And actually, when we say mental health, I think what we mean is actually mental ill health, mental illness. That's what we perceive to be mental health. That's kind of the accepted terminology, but it isn't really, because mental health is just the same as physical health. It's mental ill health, and that is a difference. And I think there's as Lynette said, there's such a stigma around mental ill health and what that means. And for me, it was burnout and stress at work, and I had that for a long period of time, and there were symptoms of that, but I didn't listen to them. And I know that I, at the time, if I had listened to them, it perhaps wouldn't have got as bad as it did, but it did become depression, because I'd left it so long that it became depression. And it's because this is the way that we're taught how to be. We're taught how to just, sort of muck in and push and keep going. And we all work in these really demanding roles, and everybody else around us is working really, really hard. And so we don't feel that we can say, actually, do you know what, I'm struggling a bit here. Because then we're worried what people will think, and we're worried that people will think we're weak or that we can't do our jobs, and we don't want to be treated differently at work. And so what we end up doing is, taking on really unhealthy coping mechanisms. And I suspect there will be people watching this that when I say my coping mechanisms at the time when I was suffering with this stress and burnout was I'd have a glass of wine in the evening, most evenings, because it was taking the edge off a really hard day. Or I would comfort eat. I'd have some chocolate because I'd had a bad day and it was making me feel better. I kept myself really busy and distracted. I worked ridiculous hours. And if I wasn't at work, I had a very busy, very active social life. And I didn't really allow myself any time to just stop and really be. Because if I stopped, I'd then have to deal with these uncomfortable feelings of stress and burnout. And so I just kept pushing and working harder. And that's what a lot of us do. But for me, sadly, as I said, it became depression. And part of me, at the time, I didn't realise what was happening to me, because I was looking around and everyone else is working like this and everyone else is doing this. So I need to do the same as everyone else. And so I didn't realise what was happening to me. And the other part was I didn't want to admit it. I didn't want to admit what was really going on for me. And so I carried on and made myself so much worse than if I just at the beginning said, I'm struggling and I need a bit of help. I did tell my boss at the time, and he was incredibly supportive, but I didn't tell him the full scale of it. And, sadly for me, and as I said, I talk about this openly now, it got so bad that one day I genuinely wanted to end it. I wanted to end my life because I just couldn't deal with what was going on. And that for me was the biggest wake-up call that I have ever needed in my life, to say, Harpreet, you know what is going on for you is it's not right, and you shouldn't be feeling like this, and you need to get some help. And it was only after that day that I thought, I really do need to get some help, and I could admit what was going on to myself first and foremost. Then I could slowly admit it to others. But even then, Heidi, I didn't tell many people at work, just my boss. I had a few weeks off, which for anyone in pharmacy land is a big deal. You don't take time off in pharmacy unless you are on your deathbed. So for me to have a few weeks off work, and I told nobody what the problem was because I was worried about being judged. I was worried about possible recriminations, about people thinking that I couldn't be a working mother and that I would struggle with a demanding role and my duties at home. And so I didn't say anything, and I did keep it to myself. Now, I was really lucky that day. I had strong anchors that stopped me from doing anything and acting on the thoughts that I had. But not everyone is so lucky. And there have been pharmacists that have taken their own lives in the past because they've just not been able to deal with whatever feeling it is, whatever issues they're having with their mental health. And so I would urge anyone who is watching this that if anything of what I'm saying is resonating, if you can recognize some of these coping mechanisms that you might be putting in place, because you're not being able to deal with stress at work and might be feeling like burnt out, please get some help. Please seek help. Please open up and say, I am struggling and I could do with some help, because I will tell you, and I bet Lynette will say the same, from the minute you are open to yourself and everyone else around you about what is going on you will only get support and people really sort of, you know, backing you and saying, look, well done you for saying what was going on. Get the help you need. You don't need to suffer in silence.
Well, there's a little bit of that, because my story is not as happy ending, in the sense of when I did approach certain people, I didn't get the support, which further kind of compounded that kind of stigma, fear and judgment. And think about what we talked about, why a lot of people struggle to talk about mental health, is that it's our upbringing. Me and Harpreet have talked about in the past, in the sense of the family upbringing we've had and the attitude towards mental health, and that it's non-existent. And so when I was struggling, like Harpreet, I hid it. A lot of people, when they're struggling with mental health, try to mask what is going on. And it's almost like a sense of denial. So you try to overcompensate, and that's exactly what I did. Like Harpreet, I worked harder, longer, and to the point where it hit burnout. And what was interesting and very scary to me at the time was how the symptoms of this mental illness manifested itself, because it wasn't just feelings of stress, anxiety, depression. It actually manifested in physical symptoms. And that's because your body releases all these different hormones when you're stressed, like cortisol, adrenaline, all these different things. And so I was starting to get arrhythmias, and I would have muscle tension and all these different horrible symptoms. Like, that's why when people experience panic attacks, it mimics that of a heart attack. So it was all very scary. But when my employer at the time was really supportive and great, it took a long time for me to actually admit that something was going on. But unfortunately, I didn't get the same attitude with my family. Now, I finally said to my mother and said, I'm really struggling. And at the time, my mum had went through quite a difficult breakup, and she'd just kind of got herself back on her feet. And so she rejected me and said, look, I can't deal with what's going on with you at the moment. And I don't judge her for that, because, again, I don't think she had the strength to do it. But even my brother, his very words to me were, get a grip. And it's these kind of stigma and discrimination that makes people hesitant. So, and to kind of add positivity to this, I think it's about choosing the right people to talk to about, if you're the person that's struggling, it's choosing people that you trust, that you think will understand you and give you that support. But yeah, that's why I think a lot of people do hesitate, is because of that background, that upbringing, and that fear and judgment. So.
Can I just come in there, actually, just on that, Lynette? I would agree with you. And I think, again, you know, we've talked about sort of family backgrounds and family perceptions of mental health. And, you know, I love my family to pieces, but they haven't always known what to say or how to support me, because they're just a bit like, we don't get it. And there's a lot of people out there they've never struggled with their mental health. They don't get it. And so it is a bit like, well, why can't you just get a grip? Why can't you just carry on and you know, get yourself up and out of bed and carry on? What's wrong with you? And I would say to anyone that actually, until you've felt that way, I think it's really, I don't think any of us should judge actually what somebody else is going through and what their own personal sort of journey is. And we will, and you know, even when you do open up, you will encounter people that either won't know what to say or they're not the most supportive. That will happen. But this is very much about you and how you perceive things and how you think about things and what you do. And whilst other people are instrumental, it all comes back to, at the end of the day, it's about you. And it's about changing your mindset and changing the way you think and perceive things, so that you no longer are, you know, fall victim to sort of negative and downward spirals of thinking that can get you into these, you know, sort of difficult situations.
That's why I think it's so important that there's education out there, and it's not just for professionals, it's for our families as well. And that's why there's a lot of work needing to be done around mental health, and a lot of understanding needed to be happening right now. So
well, thanks both. I mean, it's heart-warming to hear your stories, and that you've both come through it and got through the other end of it, so to speak. But it's, there's a lot still to be done in the area of ill mental health. And moving on to that, Harpreet, how do you think we can start to tackle the stigma associated with mental health, particularly within the pharmacy sector?
Well, I think this is a really difficult one, because, you know, we can't be sick, we help the sick. There's a real issue. And like, I mean, I said it a kind of a bit tongue in cheek, or we don't ever take time off, but we don't. And in fact, we'll push ourselves to the point of, almost like burnout or, exhaustion going to work, because we understand that if we don't go, our patients will suffer. And so we will push ourselves to do that. And so there is a real stigma around sort of, well, we can't possibly be sick. We're the ones that dole out the medication. We can't be the ones taking it. So there's a piece around that. But I actually think one of the biggest reasons why, and one of the ways we can start to tackle the stigma, is around the fitness to practice element, because we all have to sign a declaration every year to say that we don't have any problems with our mental health. And this comes back again to terminology, because we don't have to declare anywhere that we might have problems with our physical health. Okay, we don't have to declare that we might have a bad back or got bad knees or that we wear glasses or what have you, because that doesn't impact on us being able to do our job. It is no different with mental health. This is the difference. We all have mental health. And so when we're made to declare we have no problems with our mental health, I know a lot of pharmacists don't feel that they can come forward and say something because they have to tick that and say that they don't have a problem. But what that question actually means is, do you have any issues with your mental health that might stop you from doing your work as a pharmacist? That's the real question that they're asking, but that's not how it is currently stated on the form. And that one thing, I've had that many pharmacists say to me, I have been scared to even talk to me because they're worried that I might shop them to GPHC because of this fitness to practice issue. So I think that is one real way that we can start to demonstrate that actually that it's okay to not be okay. And until we make that distinction, I don't think we're going to get pharmacists opening up about what's going on. Until we have the proper support mechanisms and strategies in workplaces, which we don't at the moment. Most workplaces within pharmacy haven't tackled the issue of mental health. They haven't put in mechanisms or strategies to try and prevent and then also resolve mental health issues as they arise. And until we start to work around how to tackle mental health in the workplace, which is obviously the stuff that I do in Mental Wealth Academy, until we start to do that, we're not going to see a real difference in pharmacy. And I'm conscious that I'm talking about solutions here. These are all solutions. But we also need to talk about the prevention agenda as well. And that's kind of where that building of self-leadership skills comes in. And again, that's what I do in the Mental Wealth Academy. And I would love to see the kinds of courses and training that I do put into university courses in the undergrad, because this is what we should be teaching our future pharmacists, is how to self-regulate so that they don't fall victim to ill mental health in the future. And I'm working now on bringing those same self-leadership courses and skills to the pharmacy profession right now, so that we can start to tackle the problem in a practical way, rather than waiting for these things to happen and then having to deal with the aftermath.
Yeah, and I think you're right. Prevention is better than cure in all instances. I mean, we did the survey last year around mental health and wellbeing, and pharmacy profession as a whole showed that like 80% were at risk of burnout, which is very high figures and similar to the BMA survey of doctors and medics. So we've just had a comment come in from Julie, which says, thank you for doing this session. I'm a MHFA England instructor, and the more that can be done to talk about mental health, change perceptions and reduce stigma, the better. And totally agree with that. We need to talk about it a lot more within the profession. But thinking about that, Lynette, how do you think we can start to approach someone who we might think is struggling with a mental health issue? Because that's quite a difficult thing to do. I found that, as I said, from personal experience, trying to get someone to open up if you think they have a ill mental health or mental health issue.
Yeah, I think that when it comes, the approach is essential, because it's all about timing. So you want to do it at the right time, and the actual location is important as well, because you want to maintain discretion for that person. So it's asking when and where would be a good time to talk to them. But I think more than anything, when it comes to the approach, it's about authenticity, about really coming across your true empathetic, authentic self, to show that really you just care about that person, because that's really what a lot of us are looking for, is somebody to care about us. And when we approach in that manner, I think it's much more easier that that person can read from us that they genuinely are just want to know how we are doing and want to support us. And through that, it's all about being non-judgmental as well. As we've spoken a lot during this discussion, that it's judgment that is often at the heart of this. We're worried about how people will judge us, and that's what leads to this fear and discrimination. So you might have judgmental thoughts going through your head, because as Harpreet said, it's very difficult for people to understand different mental illnesses or even stress without having experienced it for themselves. So it's just sitting back and trying to ask how that person is, ask questions about how they're feeling. But if they're not willing to open up, like, it's about giving across the reason as to why you approached them in the first place. And what I think is a really important tip here is that, say for instance, you are in a pharmacy and it is the pharmacist that's struggling, and you might be the technician, and all the other staff have noticed a change in behaviour in the pharmacist. Say they're snapping more, they seem very much on edge, and they just don't know how to talk to them, because that's the boss as well, and that makes it much more difficult. The last thing you should do is actually say, we've observed this behaviour, or we've saw a difference, and it's that word "we," because it feels like a lot of people are watching. So if you're ever going to approach somebody to say that I've noticed a change in you, or I've noticed that you're just not yourself, but really it's about getting across that you care about that person. So when I'm a mental health first aider myself, I'm an instructor, and they have a particular approach, which is approach, assess, assist. And then some of the key elements is about listen and communicate without judgment. And then when you've listened, you're asking questions, you just have a natural conversation, and you follow that up with any kind of support or information you can give that person. But more than anything, it's trying to encourage them to get some professional support, as there is no shame in that. And as Harpreet said earlier on, the earlier we address this, the quicker the recovery. And that's something that we can give people, is that hope of recovery, is that for a lot of people, you can get better, and that is with help and support of your colleagues.
That's great, thank you. And yeah, a lot to pick up on that. And just before we finish today, Harpreet, what do you think organisations could do to help their employees have these kind of difficult conversations around mental health?
I'm really passionate that, and it's something Lynette said earlier as well, it's the term we, but in a different way. So yes, when you're approaching someone, you don't want to be saying, you know what, we've all been having a chat in the tea room and we all think that you've got a problem. It's looking at it from a different point of view, because we're looking at trying to tackle mental health in the workplace. It has to be a collective we. And if you've got somebody who is struggling with a mental health issue, again, you don't want them to feel singled out and it's all about me. So it's just turning that on its head a little bit, and it has to be we, not you, the individual, in that actually mental health is something that affects us all. We're not putting this in place just because you've got a mental health issue and we all think that, you know, there's something wrong with you. Actually, we're going to address this as an organisation, whether you are a tiny, small community pharmacy, whether you are a big hospital pharmacy with, you know, hundreds of employees, whatever you might be, wherever you are, you can start to have a conversation about mental health right now. And it has to be a top-down and bottom-up approach. It has to involve everybody, because anyone can fall victim to ill mental health. So I think it's really key that we kind of get that it is a we approach, not just about resolving a problem for one individual person. And I think the other thing is, at the moment, the way that we treat mental health in the workplace is very much from a medical point of view. We see that somebody has a problem and we refer them to either an employee assistance program or counselling or something like that. So we refer them on to that kind of medical or psychological help. But actually, it's not just a person that needs fixing. That person could be reflective of other things that are going on in that workplace, but actually they're just a bit more sensitive to it and are showing you the symptoms first. What you've got to try and do is figure out the root cause. If that person is suffering with stress from work, if that's their reason why they're struggling with ill mental health, there will be a reason why that is, and there'll be something inherent within the workplace. And that's why we can't just shunt these people off to an EAP or to counselling and hope that the situation gets better. You have to, as I say, open that can of worms in your own organisation and start to figure out what those problems are and start to put in place, as I said earlier, strategies and mechanisms. try and deal with the problem and the cause, rather than just putting a sticking plaster on the poor person that might have shown symptoms first. And that's a key element of how to tackle mental health in these organisations. It's got to be everyone involved, and it's got to be, actually, let's shine a light on some of the things that we know are causing a problem at the moment. Like you said, 80% of the profession are at risk of burnout. Why? What is that? Now, there are things out there that there are external factors that we can't change. The demand, we can't change that for medication. And some of the working conditions that we have that are not dictated to by us, we cannot change. But the things that are local to where we work, our department, our community pharmacy, our team, they're things that we can change right now. And the best way to do that is to start having a conversation, whether it's you do a session with your team, with the department, and you all talk about, actually, do you know what, this is what the issues are around mental health, and this is what we can start to do right now as a team to start to tackle some of these. That's the key, I think.
Yeah, thank you. And there's some good examples of that. Sorry, Lynette.
I was just going to kind of back up at Harpreet on that one, because I think surmising what you're pulling together is it's all about creating a culture, that culture of wellness, well-being, acceptance. And that's why, as you said, Harpreet, it's about from top to bottom and bottom to top. It's all of us having that same attitude. So in that culture, it is, I think, to embed that culture, there needs to be some education. I think it's great to kind of have these conversations, but also, like, how do we educate people on mental health and understanding it? Because I'll give you an example. It was very eye-opening to me when I trained as a mental health first aid instructor, that if you compare some mental illnesses to some physical illnesses, even things like spinal trauma, you would never put any kind of mental illness on the same level, on the same par with that kind of physical illness. But yet there are some illnesses like severe depression, severe anxiety, schizophrenia, that are all, if you look at the burden of health and the impact it has on the individual, is very similar to that. And that's why I think education, training, understanding is such a key element to really embedding a mental health culture in pharmacy, in all organisations, in all honesty.
I would agree with that. And I think you're absolutely right, Lynette. And, as you know, Lynette is a mental health first aider, so she's going and training people very much on this. I'm going to be launching my Managing Mental Health Conversations course. So it is about that education piece. And we are trying to support the sector and the profession in the best way that we can as well, drawing from our own experiences and the fact that we have both recovered and are now big advocates for mental health and wellbeing in pharmacy. It is possible. But you're right, Lynette, there is a big education piece that's needed so that people feel comfortable in order to be able to not only have the conversations, but then put measures in place as well to try and protect the mental health of their people.
I think if employers were to understand the benefit to, as you said, the preventative element, to tackle it early and to get it out in the open, address that elephant in the room, how much could be saved? I mean, I've had a lot of pharmacy groups approach me to say, like, a lot of our team are leaving with stress or are taking time off sick with stress or mental ill health, and how can we tackle this? And if they did approach this and embed that culture a lot earlier, as you said earlier on, Harpreet, a lot of these illnesses or mental ill health could be preventable.
And there's also an element here, obviously, if pharmacists and their teams are more comfortable speaking about mental health and ill mental health, then they can obviously support the people coming into the pharmacy with mental health issues as well. And that's probably another topic to talk about today, about how we support the public, because obviously with the pandemic, there's potentially more people who are going to be suffering with mental health issues as we come out of the first phase.
Absolutely. But do you know what, Heidi? If there's one thing that anyone watching wants to leave with today, it was the first thing that Lynette said, just ask them how they're doing. Because the majority of people who are struggling will put a mask and cover what's really going on underneath. I did, Lynette did, and I know countless others that do. We all do. We all put a mask and we pretend that everything's really okay. And so when people say, oh, hi, how are you? How are you doing? As a colleague or your boss might say, how are you doing? And it almost comes out without you even thinking about it. Oh, yeah, I'm fine. Yeah, I'm fine. And it's about going, no, how are you really doing? because that's the question. But how are you really doing? And that then gives that opportunity and invites that person to actually, do you know what? Things aren't really okay, and I am really struggling. So just something simple as that, and really listening to the answer. It's really easy when you're a pharmacist and you're doing 10 things at once and you're needed in 10 different places to not really be listening to what that person's saying. So yes, it's that, like what Lynette said, listen non-judgmentally, but actually actively listen to what they're saying to you. Give them those few minutes, because that can sometimes make a huge difference.
Okay, well, we're going to leave it there for today. So thank you very much for taking the time out to join us today, both Lynette and Harpreet. Really appreciate it. For me, it's been extremely informative, thought-provoking about how to have these kind of conversations. And as you say, just having a conversation about mental health with a friend, family member, colleague, it can help break down the silence and the shame around the subject, which hopefully over time will fade away. There are lots of resources on our RPS Mental Health Wellbeing page, so please do go there to find them. And there's links across, obviously, to Harpreet's Mental Wealth Academy and also to pharmacist support. So we have at RPS discussed the issue of mental health and wellbeing of pharmacists across all 3 of our boards. It is a key priority area for us, and we will be rolling out a survey for all pharmacists to help identify the extent of these issues, and then hopefully the findings from this survey will help us to better understand the mental health and wellbeing problems that the profession are facing in the workplace, that is. So obviously we'd like to hear your stories about wellbeing in the workplace, and also include some of your real world accounts in our campaign as we move it forwards. So any personal stories, reflections, examples, both good and bad, are welcome. So please do email us and get in contact with us. So thank you very much once again.
Thank you.
Thank you.